Hey guys, I'm Dr. Rob, and today we're going to talk about how to lose weight if you have PCOS. So first off, what are the symptoms of PCOS in case you're thinking, do I have it, do I don't have it? Well, I'm going to rattle off a couple of them for you. So the first one is trouble losing weight. So difficulty in losing weight. You try diet, you try exercise, you try different things, but it's still a struggle. Fatigue, meaning feeling like you don't have the energy that you would like to have. Abnormal hair growth, so hair growth on the face, hair growth on the arms, hair growth on the back, that you just don't want to have there, right? The opposite occurs on the head, thinning of the hair on the head, so you're losing the stuff up here and gaining it in places you definitely don't want it to be. Infertility is another one, problems with being able to conceive. Acne, but it's a different type of acne. It's almost like a cystic acne where it's just forming, like kind of cysts. Sleeping problems, where you have either difficulty falling asleep or you wake up in the middle of the night and have difficulty getting back to sleep. Anxiety, depression, mood swings, these type of things can certainly affect a person with PCOS. Oh, and also pelvic pain. There'll be pelvic pain, uterine pain. Sometimes you could have knee pain that alternates right to left depending upon ovulation. So those are some of the main symptoms of PCOS. Now the question is, what do you do to lose weight if you have PCOS? How do you handle this? Well, the first thing with this condition, and let me say, I've been in practice for 21 years, worked with over 13,500 patients, so we've certainly seen our PCOS cases. And the thing I could say, especially with this type of case, is you have to identify the underlying cause. There's a lot of odd causes that can be different from person to person that has PCOS. I'll give you an example. One of the causes of PCOS is there'll be certain toxins present in the body, and these toxins will create inflammation in the ovaries, which will cause these cysts to develop because the eggs don't get to be released from the ovary. Well, these toxins that are present, they're creating inflammation in the ovaries. They also create inflammation in the body. Stay with me here. This is important. Make sure you're focused in, all right? One of the most powerful anti-inflammatory hormones your body makes is cortisol. Cortisol reduces inflammation, but it also stores belly fat. In addition to that, cortisol elevates blood sugar. Your body responds to the elevated blood sugar by raising insulin to normalize and bring down your blood sugar. The problem with that is insulin is the most powerful fat-storing hormone that you make. So when you have insulin up here, cortisol up here, good luck trying to lose weight. In addition to that, it's my personal opinion, that can be an underlying or a root cause for someone with PCOS. It's actually adrenal problems that are caused by inflammation. Now that's just one. There's many, many things that can be connected to PCOS. So the first step is you got to identify the cause. Once you identify the cause, you have to get the person on the correct eating program, the correct nutritional support to help the body heal itself from the underlying cause. And then as a result, in many cases, these things clear up. However, what are some tips? What are some things you could do in the interim? So one, we want to bring down insulin. So what are some things that will help bring down insulin? Low carbohydrate diets, anti-inflammatory diets. So you want to eat anti-inflammatory foods. You want to incorporate those in your diet. Lots of green vegetables, lots of cruciferous vegetables. You want low impact carbs like sweet potato, black rice, berries, papaya, apple, pear. These type of things help to bring inflammation down in the body. They're also low impacting carbs. You can even reduce your carbs to no more than 25% of your total caloric intake. Decent amount of proteins and good healthy fats, not keto, because keto could be a little too overloading on the liver in these cases, but for sure a lower carbohydrate, good balance of healthy proteins and fats. Another thing is exercise. In the PCOS case, you don't want to exercise too hard. If you do a lot of resistance training, if you do a lot of intense weightlifting, you're pushing up your cortisol levels. That type of activity is anaerobic. It raises your cortisol levels. You want to do some light aerobic activity in the morning, maybe 15 to 30 minutes, 3 to 5 days per week. You also want to get out in the sun in the morning, let the sun hit your face. These are all really good things to do for the PCOS case. General nutritional products, you definitely want to be on a good multivitamin. It's definitely good to be on a good greens. Some other nutrients, vanadyl sulfate or vanadium, the mineral is really good. Chromium polynicotinate is a good form of chromium. Beneficial fats like omega fatty acids can also be good support. High omega-3 to DHA ratio, like a 2-to-1 EPA to DHA essential fatty acid ratio. Also some spices, cayenne is good, turmeric of course is good, ginger is good. These all help to bring down inflammation, improve blood flow throughout the body, and can be good adjuncts to use. But again, the main thing you need to do is find out what's causing this PCOS. That's what we do in our clinic, is we identify the underlying cause to a person's health and weight problem. So if you have PCOS and you want some help, please reach out to me. I'm going to put a link right down here to my free online PCOS and weight gain evaluation. And the purpose of that evaluation is to be the first major step in identifying the potential underlying cause to why you have the PCOS there. We will then call you for a free consultation to review the results and also explain more as to how we can help. So I hope this provided information for you. If it did, please like, please share, please subscribe, and I will catch you at my next whiteboard session. Thank you very much for watching today. I really appreciate it. Bye.